Dr. Kher, I think we are on a very common public platform. We'd like to know from you, what are the functions of the kidney? What is the size of the kidney? Where are they located? And how we can enhance the function of the kidney? What are the methods before we come to the kidney problems in real sense? Dr. Kher, sir.
So, very important question which Dr. Chopra has asked. And I think kidneys perform the function of purifying as a detoxifying organ of the body. Is a scavenger of the body, removes all the impurities that are accumulated in our body because of metabolism, our metabolism, the food we eat, the movements we do, and all the activities that we do generate some impurities. As the metabolism of the body occurs, we develop some impurities, and these impurities are removed by the kidney through urine. So kidney has an extremely high blood flow compared to the size of the organs. This is about 150 grams of about 10 centimeters long kidney, about 4 centimeters wide, 5 centimeters wide kidney or such. So both sides, they are on the flanks at the lower part of the chest and the between at the back of our abdomen. They are on the back side of our abdomen, and kidney is supplied 1/4 of the blood supply, 1/10 of the size of the body, but the blood supply is 1200 ml per minute. Total heart volume, which Dr. Chopra must have talked to you many times over, is about 5 liters. So 1/4 of that blood volume every minute goes to the kidney. And there is a reason for that. And the reason for that is, though the size of the kidney is small, but the function that the kidney does is extremely important because it purifies the body, keeps the body safe. All the chemical disturbances which can occur, you sit with your friends, drink 10 liters of beer on a binge, you do not get drowned. You become a saint and do not take any fluid for 10 days, 15 days, a month. You do not get dehydrated because kidneys will sense that this man has started a fast, and therefore will decrease all the urine as well as the amount of salt and water in the body, because kidney conserves that water and knows. So it's a sensing organ of the body, and it identifies that this person has consumed less or more and therefore purifies. So kidney has an extremely important function of removing all the waste products of the body, keeps the chemical environment of the body important. In addition to this excretory function of the kidney has a hormonal function also. Kidney secretes a lot of hormones. So endocrine organ like pancreas secretes insulin. Kidney secretes hormone like erythropoietin. Erythropoietin is important for making our hemoglobin. So our hemoglobin is up basically because kidney manufactures erythropoietin, and erythropoietin is the hormone which helps us to make our blood. And our hemoglobins are up because of hemoglobin. So that's the reason why patients with kidney disease invariably have low hemoglobins, or anemia is very common. Kidney also manufactures another hormone called vitamin D. Active vitamin D is manufactured in the kidney, and it helps us to make our bones strong, keep our bones and body strong. So patients of kidney disease again have weak bones, and bone disease is very common in patients with chronic kidney disease. So vitamin D might have to be supplemented in some of these, and the chemistry of the body is controlled by some of these hormones. Vitamin D controls parathyroid hormone, which makes bones weaker. So there is a huge kind of alterations which occur in the chemistry of the body, by which in patients who do not have kidney function which is good, in those patients, then many of these hormones are altered, they are deficient, and therefore there is many alterations which occur in the body which affect many other parts of the body. So when kidney disease occurs, it's not only that the kidneys are affected, but because kidneys excrete waste products, produce various hormones, there is alteration in almost every organ of the body. So that's extremely important. Kidney is also very important in controlling blood pressure. Very, very important organ for controlling blood pressure, because salt is inherently connected to high blood pressure. Increase in salt intake, there is increasing incidence of high blood pressure. And kidney is the organ which excretes the sodium and the other electrolytes along with water. And in patients with kidney disease, when salt and water is not excreted adequately, the body accumulates salt and water, becomes swollen. That's why swelling is a very common early symptom of kidney disease, because the salt and water which you and I take are not excreted by the body, are not excreted by the kidney, and therefore they accumulate in the body and there is swelling over our body. And that's why kidney controls blood pressure. Kidney also secretes a hormone called renin. And renin is secreted based on what is the blood supply to the kidney. So kidney's blood supply, if it goes low, like there may be narrowing in the artery in the kidneys, that can also cause, which is called renovascular hypertension or renal artery stenosis, which can cause hypertension, because of that narrowing in the blood supply, there is increased secretion of renin, and that causes high blood pressure. Also, an important cause of high blood pressure. So, kidney is not only affected by hypertension, but kidney is an important organ which can cause hypertension, both by the parenchymal disease, which I mean is diseases which affect the kidney's substance, the filters that we talked about, the intervening areas, the interstitium or the tubules that we talked about. So those parenchymal diseases can cause hypertension, and then the renovascular hypertension, which is caused usually by the decrease in the blood supply to the kidney, and that can cause hypertension. So two important messages that are important. One, that kidney is an organ which can be affected by uncontrolled hypertension, and kidney is the organ which can cause blood pressure, and therefore is an important organ. Whenever one is looking at the causes of blood pressure, one should always look at kidney function to see that kidney is not a cause of hypertension. And uncontrolled hypertension is extremely bad for kidneys. Those patients who have kidney disease need blood pressure control, like Dr. Sani said, 140/90. I would say for patients of kidney disease, the blood pressure should be 130/80 and less. By and large, lower blood pressures are much better for the kidneys than higher blood pressures.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।